We're same page. I'm Mary Kate. This is JD and Brendan. We're excited to be here to talk to you today. I'm going to start off with a few quick numbers. So there are 12 million children in the US with chronic illness. That means about 1/6 of the children in this country are vulnerable to lapses in care because of poorly planned transitions. So as they move out of the pediatric care environment into the adult care world, there are a lot of changes. And if they're not well prepared for these, our concern is that they will have lapses in care, which will make them more unhealthy. Some of the biggest pain points that we found in this transition is the transition from pediatric to adult care, in the sense that pediatric care is very family-centered. Decision making is usually shared with your parents, and then when you move to adult care, you are expected to be much more independent and autonomous. In addition, in pediatric care, we usually see a lot of very well-coordinated care teams. If you have a chronic illness, you've probably had it since you were younger, and you have a provider that knows this history. But then as you go on to an adult provider who's someone new to you, you have to both explain this history to him, but also him or her, I should say. But you also have to act as the link between your specialist and your primary care provider. So that leads to a lot more responsibility that you have to take on as an adult, and we really want to simplify this. So growing up is hard enough. We want kids to be able to focus on thriving and going off to college, not sitting at home being ill because they haven't planned for a transition with their provider, and now they've experienced a lapse of care. So this isn't a new problem or something that's a secret. In 2002, the leading American Pediatric associations issued a consensus statement calling for better planning and developmentally appropriate tools for this. 10 years later, in 2012, they did a survey of practices to say, hey, how are we doing with this? And it turned out they weren't doing very well at all. They found that most pediatric practices neither initiated transition planning nor offered transition support. So there's still a very great need for this. Why does it matter? If we look at poorly planned transitions, like I mentioned, we see lapses in care. Lapses in care lead to a lot of expensive medical interventions. We see a lot of healthy kids who could have been doing really well fall behind on their healthcare. If we look at asthma, for an example, there was a study done that showed that over time, the costs for poorly controlled asthma continued to rise, and the well-controlled asthma group actually came down in costs. This is where we think Same Page can come in and really make a difference. I'm going to turn it over to JD to talk about more of our features.
Thank you. Okay, so to address the needs of these 12 million children and the 24 million people that take care of them, Same Page is designed to provide them with structure and support throughout the whole transition process. And so in terms of structure, we mean tools for maintaining schedules and remembering important events, tools for tracking personal progress and logging essential health information, and tools for assessing a child's readiness to advance through the various stages of a complex transition. In terms of support, we're talking about supplying our users with interactive learning so that they can become empowered with knowledge about their conditions, be more likely to be their own health advocates. We're talking about shifting tasks from caregivers to children to simulate the natural progression of responsibility that a child experiences as they're growing up. And finally, we want to provide social connectivity to our users to link them with a community of users with whom they can share, connect, and identify. This is Same Page's dashboard, and you'll be able to access it on all PC and mobile devices. We've designed it to be accessible, intuitive, and above all else, user-friendly. The dashboard compiles a whole lot of information. We want users to be able to access all this on a moment's notice. So we have contact and background information for caregivers. We have conditions and therapies, which can all be viewed in more detail simply by cursoring over the associated buttons. And if our users want to see more, they can click the buttons, go to a detailed view where they'll have access to all the tools I was talking about. This is an example of what it would look like for a user to manage their asthma with Same Page, but we expect many of our users will be dealing with a whole host of conditions. And it would look more like this. We have general transition asthma, type 1 diabetes, et cetera. and we can see that they're managing it on our timeline here. These are the users that we think we can provide the most value to, and the ones that we're focusing on currently. I'm going to let Brendan tell you more about our early feedback and current directions.
So in speaking with patients and providers, we've seen that this is meeting generally a pretty large need. We've also spoken with the Teen Advisory Council, which is a group of patients at Boston Children's Hospital, and they've not only vouched for the need, but also that their willingness to use this platform. When we look at the competition that's out there, what's really unique about SamePage is that it's catering specifically to children and helping them along their journey. And that's what really makes us stand out against companies like Kerbo Health or Gecko or these other competitors. As for the business model that we're looking at a freemium model, and the idea there being that we can reach the maximum number of patients. With the freemium model, we'll be supporting the site through ads, both native and supported ads, and then also looking to do a premium version that's ad-free with additional features. For driving the site, we'll also have databases that we'll be able to use for patient insight tracking and also to provide guidance to patients and their families. And finally, in order to roll this out, what we're looking to do is partner with disease organizations like American Diabetes Association. That way we can provide their patients with the support they need, but also gain access to these markets. So the SamePage so far has been really driven by the three of us, Mary Kate, Josh, and myself, but we've benefited tremendously from the support of a number of mentors, and many of whom we met through the Insight Health program. And if you're interested in the work that we're doing, please feel free to contact us. We'd like to particularly thank Powell and Casey for the work that you guys have done, and thank you all for your time, and we'll look forward to the questions. Thanks.
So how do patients get their data into SamePage?
So there's a sort of a lengthy account creation process. So we ask them sort of soft clinical questions to try and get them to put in some of this information, and then other information they'll be entering into surveys that we're asking. So that'll be integrated into the education platform. They'll be learning about sort of what they have, and then they'll be answering questions about what they have, and that's where we'll get most of the data.
Thank you very much for this great presentation, and it's a great pleasure to be here. Thank you, Paula. If you were to force rank who you would design the product for first, would it be the teen patient, the team of doctors, or some third party that might be paying for it?
Sure. So I think the key element to seeing this succeed is that teenagers are willing to use it. So they would be our primary design focus. I mean, if you can't maintain their interest, then you're definitely not going to have a successful product. We also want to work very closely to, or at least be aware of the needs of parents as well, as we anticipate them really driving this from the start as they have younger children. So I think that would be really the people that we need to keep interested if we want to see this succeed.
All right, thanks.